Assalamu alaikum students. Today I am here with a very interesting topic that is carpal tunnel syndrome. So without wasting our time, let's start the video. Carpal tunnel syndrome is when the median nerve is compressed as it passes the carpal tunnel. The carpal tunnel is an opening in a wrist that is formed by the carpal bones on the bottom of the wrist and the transverse carpal ligament across the top of the wrist. Here are some causes of the carpal tunnel syndrome. Myxoedema, edema premenstrually, diabetes, idiopathic, acromegaly, neuroplasm, trauma, rheumatoid arthritis, amyloidosis, pregnancy. Myxoedema is caused by the thyroid hormone deficiency. Edema premenstrually. It is responsible for the bloating, such as sodium and water retention, and edema in the memory region and in the upper and lower limb extremities. Diabetes is a disease that occurs when our blood glucose, also called the blood sugar, is high. Idiopathic type 1 diabetes is defined as a diabetes not associated with the autoantibodies but for which insulin treatment is required for their survival. Acromegaly. Abnormal growth of the hands, feet, and face caused by the overproduction of the growth hormones by the pituitary glands. Neoplasm. Neoplasm is the cytoplasm of the nerve cell. Trauma. It is a challenging emotional consequences that living through the distressing event can have for an individual. Rheumatoid arthritis, joint pain, swelling and stiffness. Amyloidosis. It is a rare disease that occurs when a protein called amyloid builds up in an organ and it makes the organ not work properly. And the last one is pregnancy. As you can see, in the normal carpal tunnel, the median nerve is equally spaced under the ligament. But you can see in the carpal tunnel syndrome, the median nerve is compressed and pinched. Here are some symptoms of the carpal tunnel syndrome: numbness, tingling, and pain in the hands and wrist. There are few different factors that can contribute to the carpal tunnel syndrome. Repetitive motions like typing or using a mouse can put a lot of strain on the wrist and lead to the inflammation. Treatment of the carpal tunnel syndrome. Wear a wrist splint. Wrist splint is something you wear on your hand to keep your wrist straight. Stop or cut down on things that may be causing it. Use painkillers and do some hand exercises. Okay, here are some massage therapy for the carpal tunnel syndrome. Initial warming up. Open and close your hands as for few minutes. Remember to always maintain your wrist in a neutral position, meaning not to bend your wrist. Now shake them up a bit to loosen up the muscles. Begin to massage in a small circular motion, say for about 60 seconds. Don't hurt yourself, do it in a right amount of pressure. Here are some hand exercises you can do at home. Don't hurt yourself, do it in a right amount of pressure as I said earlier. So that's it for today's video. I hope you found this information helpful. Stay awesome and blessed. I'll catch you in the next one.